We're talking about EKG class. It's only makes sense that you know the coronary arteries, right? And we'll soon find out why. There's main arteries that feed most of the heart, and they just branch off into smaller arteries. Hi, Nai, good morning. So you have to know more or less the location of them, their name, obviously, and what happens. So the posterior descending, posterior means back, so the back side of it. Descending means it goes down. So it's located in the back part of the heart. If you look at the heart, I don't have my little model, I didn't bring it here. But if this is the front, okay, you rotate it this way to the left, the descending artery would be right here. Goes down, right? You have the circumflex, which is the one that comes around, and then the descending, posterior descending, right? So it's in the back, yes. So if a person has a heart attack and they complain of pain between their shoulder blades, what's happening? Yeah, there's an occlusion, right? In that particular artery, and one of them close to them. So that's why when we look at the EKG, where do you think we might find changes in the EKG? Which leads? Think about it. Yesterday, I saw an EKG, a real EKG on one of my patients, because he had a regular one, right? And it says, I'm normal. And they're trying to pull the teeth out on the resident because tiene dos podridos, right? And well, the dentist doesn't want to take a risk on this older person. He's not that old, but he's an older guy. He has hypertension, he has strokes, and so on. So what is his risk of him having a cardiac problem during this procedure? So he needs to get cardiac clearance, right? So the family doctor sends him to a specialist, a cardiologist, because the EKG came out abnormal. So I'm looking at it and like all the leads that are supposed to be positive are negative. The chest leads, V1 through V6, you know, they're supposed to be upward deflecting, right? If you remember, it's a P and a Q and a R, like just like that, right? They start here, right? Right, sternum chest border, V1, V2, V3, 4, 5, 6, right? Okay, so they're all supposed to have an upward deflection. And I see that's like, they're all downward deflection, they're onward deflection. Like, okay, well, something's happening in the, remember the chest leads look at the heart from a horizontal views, like slice it across like that, right? So they're looking right through the heart, all the way to the back. So then I saw other leads también, like, and then I could see that, no, we haven't talked about it. We see it's something called axis deviation. Okay, and it sounds really complicated, but I can explain to you real easy what it is. But my board's over there. But anyways, so back to this. So I saw the EKG and it's like, this looks like a heart attack somewhere in this part, but not on the front. ¿Eh? Lo que tenía acá. No, pero ahí tiene uno. No le he colgado, mira, el paquete todavía. So I saw the EKG, like something happened here, maybe not on the front part, but inside, deeper into the muscle or in the backside, right? So I hadn't looked at the what's it called, the identification, like lo que decía, because it gives you the answer, right? Not the answer, but the interpretation. It gives you the interpretation, but I hadn't looked at it yet. I didn't want to see it because I wanted to gauge myself, right? This is what it looks right, and then I saw that some of the leads are also supposed to be positive, like lead V1, okay, which looks at the heart this way, and V2, it looks at the heart this way. E3, también, they were more negative than positive. So this person has heart enlargement and axis deviation, because as the heart gets bigger on this side, it throws out more signal, more impulse, and they call it axis deviation, right? The heart is when somebody has hypertension, high blood pressure. What happens is that the muscle, the myocardium, the bigger part of the heart gets bigger, and they call it hypertrophy. Hyper is high, trophy is change. So it enlarges. A lot of people have this problem. But why is that a bad thing? Well, because as the heart enlarges, the myocardium, the muscle, if you look at a split section of the heart, the inside of the ventricle itself gets smaller. Why? Because the heart is enlarging to the inside. It doesn't enlarge to the outside. See, as it grows on the inside, It's like your muscles when you work out, right? But except this thing makes your ventricle smaller. So how does that affect the person? Think about it.
No sé, se depolarize, yeah.
Depolarize, okay, yeah, you're on the right track. It doesn't depolarize as maybe as strong. You think, well, it is bigger. It should depolarize, better. Like, no, it doesn't. Because if you think about it, make a comparison between a person that works out, pretty much normal, but they're fit, right? You can see that they work out. And then you have a bodybuilder with muscle like this. Who's faster? El otro, right? Why? Because they're leaner, they're faster, they're average, right? They're fit. So if you have your heart like a bodybuilder, it's not going to work better, more efficient. So you want it just fit. You don't want it big, right? So that's what happens. The inside of the ventricle enlarges, therefore, less blood fits in there. There's volume, which leads to what?
Low cardiac. Low cardiac output.
Low cardiac output, right? Because there's less volume going into it. It's going to eject, and then it's going to contract less because it's so big. Decreased cardiac output, right? That's what it's all about. So that's why when you have hypertrophy or in a large heart, it's not a good thing. And it happens with people that have very chronic high blood pressure and congestive heart failure. Okay, so the arteries itself feed the muscle. And if you look on page 337, you look at a breakdown of the arteries. Okay, it has 3 layers. We have the tunica adventitia, which is the outer layer. If you think about it, if you see a cable from the internet or your cable TV, if you notice they have a black layer, right? And then it has like a foil paper layer inside, and then it's got another layer, and then right in the middle you got the little straight wire. Well, if you think about your arteries, they're in layers. Some of them are more resistant. They stretch more, right? Which is the adventitia. This role is to stretch. They're made up of very small layers of we call it smooth muscle. So your arteries are actually muscle, right? So they stretch just like your other muscles, right? You have then your tunica media, connective tissue, which connects the tunica media to the inside, to the tunica intima, the endothelium. The tunica intima is 1 cell thick, like your skin. That is how thick it is. So, say, well, how do people get, occlusion in the arteries? Well, the fat, okay, the fat that is stored in the arteries, it's not inside the lumen, which is the opening of it. It's between the layers of the heart. Okay, between the layers, between the intima and the media. That's where all the extra sugar or fat is stored. So the lumen becomes smaller. So you have decreased blood flow to that part of the heart, whichever artery is clogged, right? Especially if it's one of the main ones, right? If you look on page 237, the top picture, you see the arteries labeled there. You have the circumflex circle, right? It goes around. The circumflex artery goes all around your heart. So usually you don't have problems there. But if they get smaller, you look at the marginal artery, which is feeds the right side of your heart, marginal, the right margin of your heart. And then on the left side, you have your which is the anterior descending. Anterior descending.
Posterior descending.
No, the posterior is in the back. Oh, I'm sorry, I was looking at the back picture. The left circumflex, it should be there it goes. The anterior, the red ones are the artery, right? The anterior interventricular artery. They all originate from the aorta. I don't know if you can see a picture there. You see the aorta is the largest artery in our body, right? That looks like an arch, and then it's got 3 little things sticking out. And then if you look between that and the vein, the left pulmonar, como que sale, that's where all the coronary arteries branch off from the aorta. Okay, and then they branch off into the circumflex, into the anterior descending, and they get smaller and smaller. So on your left side, the main ones is your left circumflex, the left coronary artery, the left anterior descending, and your diagonal arteries. So all those affect or feed most of the left side of the heart, which is the left ventricle, which is the main part, right? And then on your right side, you have your arteries, your right marginal artery, your right coronary artery, and then it just gets smaller and smaller. And it also has some fat covered over that yellow stuff. We all have some fat over all of our organs. So we should have some fat around it, but not too much, because then it impairs the organ itself. So all these arteries will get occluded over time. The studies show that an average at 15 years old, that's when your arteries are the healthiest. 15. After that, it's downhill from there. They start to get occluded. And now that's assuming you're a young, healthy, right? Young person. If you were not, or you're not a healthy individual at that stage, then obviously it's probably worse. So what are some of the symptoms, the cardiac symptoms that you find on a person? Shortness of breath. Why do we get short of breath?
Feels like there's enough cardiac.
Where?
No.
Well, no, think about it. Your heart is just a pump. It delivers the blood.
In your
In your lungs, right? In your lungs, yes. What's happening? Your lungs are like, we need blood flow. We need to pick up some oxygen and get rid of some CO2. What's going on, heart over there? You need to start pumping faster. So the heart starts pumping faster. Okay, so the lungs tell you when there's a decreased amount of oxygen to them, right? And then your heart reacts to it. Okay, so your lungs give the assurance of breath. The sweating. Why do we start sweating? Well, they call it a vagal response. A vagal response. Okay, it's like when you feel nauseated or vomiting when you work out too hard. It's a vagal response, right? The vomiting comes from your pretty much your intestines going backwards instead of going down. It wants to come back up to so you start to puke, right? Sweating, the circulation is redirected. Okay, epigastric discomfort, neck pain, cough. The symptoms are, there's a lot of symptoms, and like you said before, females are less likely to have any symptoms of a heart attack. So don't expect someone to have all these symptoms, especially if they're diabetic. It's even worse. The diabetes, they have less symptoms. Pressure in the chest. But I think the most common ones that give away a heart attack are one, chest pain, the sweating. Well, anxiety is like a panic attack, right? Pero yes, you get anxious, right? You feel a sense of impending doom, like you're gonna die. Just like when you get a regular panic attack, it kind of feels like that. Except you start to get diaphoretic, you start to sweat. When you have a panic attack, you don't sweat, right? You just feel palpitations, right? And you're like, and then you might even feel the floor move, right? Dizzy, lightheaded. You feel like, because your heart is going like that, so that's why you feel lightheaded, right? It's skipping. So, but the sweating, the blood pressure is going to go up just like a panic attack. It's going to be normal that it goes up. Okay. The nausea, those are pretty sure signs that a person is having a heart attack. Again, what is a heart attack? It decreased blood flow to part of the heart. Okay. Remember, we cannot see it. The only way to detect the heart attack is to actually do an EKG, right? And that's if you have the machine right there and then, right? Or something, a portable EKG machine, or they go to the ER. The heart attack may still be in progress. There's decreased blood flow. It's called ischemia. Decreased blood flow, right? To the heart is ischemia. And then as the decrease worsens, then you have what you call infarct or tissue death. Now you had an actual heart attack. How much is an infarct? Well, it depends how much tissue was short of blood flow. And then you can see the EKG and you can see, actually look at the area where the heart attack. Remember when in the beginning, when I told you, look at the leads, this is why lead 1 is looking at this part. So if a person has a heart attack, you see the changes on the lead 1, what artery might be occluded? Well, it could be the circumflex, it could be the left or coronary artery, the left, anything on this side. So if you look at lead 2, looking at the heart in this direction, remember the energy, electricity coming this way, but the lead looks at it this way. So you might be looking at the left ventricle, which is also the left coronary artery, the left anterior descending artery is occluded. So right away, you can make a pretty much approximate estimate of where the person is having the heart attack by just looking at the EKG. Okay, so we're not dealing with dysrhythmias. Now we're dealing with actual heart attacks, right? First it was a dysrhythmia. Now it's becoming into an actual heart attack. There's a problem some people have. It's called angina. Angina is sudden constriction of your arteries. Your arteries are dilated, and then all of a sudden they decide to close. They close, they shut down. Not completely though, right? Otherwise you would have a massive heart attack. But they close, they narrow the blood flow, decrease the blood flow to the heart muscle. So your heart starts into a panic mode. Your heart starts pumping really hard. Why? Because it wants to feed itself the blood, because it senses that there's decrease of blood. So it starts pumping super hard. So what happens to your blood pressure? It goes up. You feel the heart wants to beat out of your chest, the palpitations, right? This is called unstable angina. Unstable. When somebody has this problem, it's a serious problem. It's a serious problem. They can have a heart attack. They can actually have the heart attack and die. So for that reason, people are giving medication. A medication that was given the Nobel Prize for the person that developed it or discovered it, right? It was used it is used in dynamite, to make dynamite. It's called nitroglycerin. You might never heard of it. Nitroglycerin. Nitro is for nitrous oxide. So nitrous oxide, I became a big believer in nitrous oxide a few months ago when I started to learn more about the role of nitrous oxide in your body. Your body makes nitrous oxide, but you have to consume it. You have to eat it. Well, how do you eat it? Ever heard of it, nitrous oxide? You probably heard nitrous oxide, they put it into cars. They put little tanks in cars so they can race, they can go super fast. Okay, not that kind of nitrous oxide. That's nitrous something. It sounds like oxide, but it's different. So anyways, our body produces nitrous oxide by itself. That's what makes your arteries dilate, right? So when you start exercising, your body starts to produce nitrous oxide, okay? But if you consume it, it gives your body even more endurance, right? It's not against the law, it's not banned or anything like that. You can consume it from where? From green leafy vegetables. It's green leafy vegetables, believe it or not. Otra vez con vegetables, right? That's where they get the nitrous oxide. But you could also take it in a capsule because they sell it already in capsules. Believe it or not, the role of nitrous oxide was just discovered in 1984 or 89. It's just they knew it existed, they just didn't know what role it has in our body, right? Well, it has a big role. So when people were getting in COVID and they started to get short of breath, right? They should have been giving them nitrous oxide so they can dilate the arteries and increase the blood flow, circulation to the lungs, circulation to the heart, and so on. Some people they did tests on them and they gave them nitrous oxide and they discovered there was a huge benefit. So how does that help you? If you're not an athlete, you don't have COVID, how would it help you? It maintains you, it increases blood flow to the brain, to your vital organs. So in essence, your body will be working in it better, right? I purchased capsules, right? Supplements to exercise, right? And I wasn't like, this probably doesn't even work, right? I was skeptic, like anything else. So I decided to take it. It says take 3 capsules. It says no, I'm just gonna take 2 because I don't know if I'm gonna be all jittery, because it does contain some
Give you
caffeine. Yeah, give you energy and all that stuff. It has like 4 different other ingredients. So I researched them, right? Supposed to be natural ingredients. I researched them as like, oh, okay, seems pretty safe, right? So I took it, and did it make a difference? Yes, it made a big difference. It made a big difference because normally I could usually just work out like an hour, and I was like already tired.
Tired.
With these supplements, I only took 2, not 3. I did like 2 hours, and I wasn't even tired.
And you have to drink it, but you have to do it, like, you have to work out.
Yes. Now you don't have to work out. You can still take them, and you can feel the difference. You will not get tired, right? Of course, the effect is only for so long. You only take them once a day, or when you're gonna exercise. You can still take them. Like I still have them. I don't take them because I don't exercise right now, but when I do, it makes a big difference. Big difference. So
Look, I started taking también unas vitamins, and it, like, I mean, so
see,
it's just like the vitamins de así como unas women,
oh, okay.
see, like, like.
For age appropriate vitamins, yes. Yeah.
And-
There's a lot of them, especially when you go in your
Sí, pero me estoy comiendo una vez al día, so it's like,
Ah.
I haven't.
Okay, see.
Vitamins and it.
I'm taking vitamins right now. I'm taking it's called adaptogen. I have vitamins. I don't know if you've seen them there. I sell them too. I have
Oh, really?
yeah, I have an account with the company that produces it, and I sell them. I'll send you the information later.
Oh, sí,
And you
please.
can look at it, and you can ask me about the
Sí,
supplements.
a mi esposo también le gusta mucho tomar vitaminas, because he works y luego a veces se gana cansado y like vitamins supplement
Mhm.
también. Y cada ratito anda cambiando de vitaminas, no ha encontrado ninguna.
It depends what he needs and what he wants. Like, what are his goals? What does he need? His health condition. And when people ask me, like my sister, she's going through severe menopause, and she's only 44, I think she's 44. She's having a lot of like super heavy menses and all that stuff. So she's super anemic. So she's like, what do I take? What do I take? I don't want a transfusion. Is that close, right? Answer up was this: you have like all these things, folic acid. You need to eat green fruit vegetables. You need to take an iron supplement. There's iron injections. There's so many things that you can take. You go
Yeah.
vitamin B12.
That's the one that helps me a lot.
Which one?
La B12.
The B12. There's
Yo me la
injections.
inyecto.
Vitamin B12 injections.
Ahí está
Vas a
el
Mexico, te las traes. Yeah, I told her, like, if you want it, just tell me. I'll get them for you.
Yes, I get them over I do have like it's every 3 months.
Yeah, you don't have to do it out so often. Even iron injections too. Like, you try to give your body the best shot, okay, to help itself, and that's why there's supplements.
Like como ahora que así está, because I'm doing a diet, así no, pues not diet, pues no creen si diet, pero
A lifestyle.
better, lifestyle. I'm eating better, I'm
Mhm.
working out, pero I have noticed that I'm losing a lot of hair. A lot of hair.
You're losing a lot of hair.
Yes.
Um,
Me estoy quedando pelón. I don't know if it's I'm not eating right, I'm not getting the
Mhm.
that's why I started taking the vitamin.
Yeah, I know. But you take any vitamin that you think will help you. I think I have one. I'll show it to you in a few minutes. So back to cardiology. So the signs of an unstable angina, they're random. They happen like random anytime. Okay, I had a lot of patients like that, and we had sent them to the hospital when they had their blood pressure like at 180, 190, and they complain like buzzing sounds in the ears or headache. You have to send them out because they can actually have a heart attack. So uh, the pains, the episodes are more frequent of the chest pain. That's what it is. And they take medications called nitrates because they're derived from nitrogen, nitrous oxide, right? So they take it and it helps them to lower their blood pressure, right? Throughout the whole day. It dilates those arteries, again, by the effects of nitrous oxide. Dilates those arteries in the heart so they can have more blood flow and reduce the episodes of angina. That's the whole point. There's IMDR is one of them. There's just a bunch of them that are out there for them to manage and of course the nitroglycerin. The nitroglycerin is a very, very small tablet. It comes in a spray now, I think, in a gel. They put it under the tongue and it gets absorbed like that. Okay, it gets absorbed really quick, and it dilates the arteries in your heart like that, right? Good morning.
Clarisa, ya no
Made it.
estamos, Clarisa.
So
For real, they're leaving.
yeah, we're gonna cut it a little short today because I got a meeting to go to, a seminar. But anyways, have a seat, because you're already here.
Okay, so I'll take my dad to the doctor.
Okay. So we're in chapter 14, page 340. We're talking about unstable angina. Atypical patients, not all, of course, they have the same symptoms, they're all different, but the chest pain is the most common one. Chest pain is identified by doctors as the most important heart attack symptom in both women and men. However, women often present with different complaints. What are the signs and symptoms of women and percentages? Shortness of breath, 50% of women report when they're having a heart attack. Weakness, unusual fatigue, cold sweat, dizziness, indigestion. Those are in percentages. So not everybody presents with all the symptoms, right? Especially women. Same thing for diabetics. They're gonna have less symptoms because the diabetes damages the nerves. So the nerves gives you the symptoms. So if your nerves are not working, then you're not gonna get the symptoms, right? So that's for diabetes. They get a atherosclerotic plaque. Well, not only diabetes, but everybody. But if you have diabetes, you are more likely to get plaque in the arteries. Okay, so that's, you have an increased risk of getting heart disease. Not to mention, even in people that are skinny, they think, oh, I'm never gonna get sick. They still get very bad circulatory problems, very bad. I have a man, he's very thin still. He's already 80s, okay? But he has super bad circulation in his legs. Very itchy, super itchy because there's no blood flow to the skin. Okay, it's completely dry. And then the toes start to die off, okay? And then I mean, everything, except he has a good heart. Like not as a good person, but as a physiologic, he has his heart is good. It just has bad circulation because a lot of these fatty deposits to go into the smallest arteries, which are the ones that are furthest away from your heart. But if you have diabetes, it's another story. So the cardiac symptoms experienced by patients with diabetes are similar to classic symptoms. However, symptoms experienced by a patient with diabetes may be transient. What is transient? Temporary. Temporary. The most common symptoms include chest pain, and discomfort in arms, shortness of breath, sweating, nausea, lightheadedness. So again, everybody's going to have different symptoms. It's just a matter of who they are. Neuropathy, that's why they don't have the symptoms, because their nerves are damaged. Diabetics get a lot of complications. Diabetics get a lot of complications. They lose their vision, they lose kidney function. Of course, they have heart disease, they lose circulation, they have nerve damage, they get gastroparesis, which is their stomach slows down. They have so many complications, right, that we know of right now. They probably have more. Elderly people, their symptoms are a bit different. Profuse sweating. Okay, if somebody's sitting down or in the bed and they're sweating, I have a patient. He's on dialysis, right? He's already sick. And when I didn't know him before, he's always cold and clammy. Clammy is like sweaty and sticky. Yes, right? So why is he like that? It's like, oh shit, is he having a heart attack or what? So I was scared, but I was like concerned about it, right? So check his vitals and all, blood pressure perfect, heart rate is perfect. So why was he clammy and cool? Tell me. You should know.
Had low cardiac output?
Yes. Yes. Low cardiac output. I'm telling you, that's what it all comes down to, right? His heart is already so weak, right? So old people that have a weak heart are always going to be very cool to the touch, right? Very cool to the touch. So he's already missing one leg, no, actually both legs. He doesn't have both legs. He's on dialysis, right? He's just on borrowed time, but a very sweet man, nonetheless. So those are elderly patients,
Ya, o
guys.
sea, cuando escuchas a los señores allí, dicen, like, te estamos robando oxígeno, ya nos queremos morir.
Some of them say that. I mean, they're ready to go.
Yes,
They're ready to go. They don't care. It's like, no, cuando qué. Like, they get tired of living, right? You get tired of living. Okay.
Nomás estamos robando el oxígeno.
Some people say, well, I want to live forever. Digo, ¿pa qué? Everything's the same, right? Everything is the same over and over. You seen that movie? Is it The Green Mile? The Green Mile? No.
Es el que te sick.
Yeah. And
She has
and
like-
he outlives everybody pretty much. He outlives everybody, but he's cursed with this thing that it doesn't die. It doesn't die.
Yeah, it's that when you hear them like, God, déjenme en paz, like,
Yeah, some
no
of
me estoy
them,
robando oxígeno
some of
y
them are ready to go. Okay, they don't care, right? And my 101-year-old lady that I have, I don't think she's ready to go. She wants to live. Like, please. Her body's already shutting down. I already know. I can tell, right? She's decreased urine output. That means a decreased blood flow, right, to the kidneys, or decreased output in general. Okay, our blood pressure is still very good though, low 100s, high upper 90s.
Yeah,
But she's very petite, very small lady. But she's withering away, just slowly withering away. And she knows that already. Her appetite is not there. Medications aren't working, right? That normally work to increase your appetite. It's just her body just,
it's shutting down.
yes. But she's still very alert though. All right, acute coronary syndrome. This is a syndrome is a group of symptoms, right? It's a group of symptoms or conditions. Let's see where. What is acute coronary syndrome? ST segment elevation, myocardial infarction, or non-ST segment elevation. Bless you. So, have we talked about ST elevation?
No.
No, we haven't, right? I know. Where did we skip it? Well, let me just tell you what it is, okay? And again, I wish I had my board here. When you have your P, Q, R, S, right? And it comes back up to the line, and then you got your T wave. A T wave is an upward positive deflection, right? So when there is lack of blood flow to the muscle, the R does not make it down. There's no S. Okay, it comes back, it's coming down, and then makes like a little chair, and it comes back down. You'll see it right now in the book. Okay, that is ST, because the S that's supposed to come down, and the T over here, the S and the T are connected, so they call it ST elevation. That is a sign of an acute ongoing heart attack. If you see that, they call it also a tombstone because it kind of looks like a tombstone, like that, right? So if you see ST elevation, obviously that is a bad sign, right? But there's people that don't have their ST elevation and still have a heart attack. So how do you determine that? Well, we'll see in a minute. Okay. So ST segment elevation, depression or elevation, T wave inversion. The T wave is supposed to be upright above the isometric line, isoelectric line, and then a pathologic Q wave. What is a pathologic Q wave? Where's the Q wave located? Before the R, right? It's a little Q, right? Like a little dip, and then up goes the R, and then comes back down. Then your S below the isoelectric line is your S, comes back up, and then your T wave, right? Okay. A pathologic Q wave is a Q wave that is more than 50% of the size of the R. If the R is this much and your Q is this much, that means you have you had a heart attack. It could be unknown origin. You could have had it months, years ago, and never knew. So the EKG, you can see a pathologic Q wave, and that means that somebody had a heart attack at some point. The ST elevation more is an acute, like right now. The Q, it could mean that it could have happened at some point. It's an old, they call it undetermined age.
Te voy a cambiar un poquito el tema. Mis Reyes vino a decirme algo que about an address. Okay, if you want, querían hacer lease, un address en Rio Grande.
Oh, yeah, yeah.
Okay. Ahorita me acabo de acordar, una de mis amigas tiene un body shop, her husband tiene un body shop, will that address work?
Any commercial. Any
Pero es
commercial.
ahí como en el centro
Like,
commercial.
They don't ask us what's in there or where. No.
Ah, okay, así
As long as
chiquitita.
they check that it's a commercial address.
Okay. Sí, no, ahorita me acordé, dije, pero it's just like a body shop, like pintan carros y eso.
That's fine.
Okay, I think
So a Q wave that measures more than 0.04 second or wider in duration and is, or 1/3, I'm sorry, I said 50%, 1/3 or more the height of the R wave, then you have a pathologic. I said 50, no, it's 1/3. If it's 1/3 or more, then it's pathologic, okay? Means it's bad, right? Between 20 to 25% of the people that have a heart attack have STEMI, or non-ST elevation myocardial infarctions. It occurs because of an incomplete occlusion of coronary artery. I don't know, I'm getting these calls from Nigeria or somewhere. It has like a black, red, and yellow flag.
Oh.
Yeah. It's already blocked and it comes back again. The term silent refers to patients who do not present with the classic MI symptoms. So they can have a silent heart attack. A silent heart attack. That's not good. Let's look quickly at page 343 because I got to split. Oops. Okay. Quickly, not quickly, but look at the lead one. Let's look lead one individually. And now it's hard to tell. Okay. You can't really make out very much of lead one, can you? No, right? Let's look at lead two. Okay, well, you got a P, you got a P, you got a Q, R, everything looks pretty normal on that one, does it? Except for the last beat in lead two, huh? Can you see it? Can y'all see it?
La que tiene la blue line.
Yeah. So remember, lead one, looking at the heart from the left lateral. Lead two, looking at the left from the left lower left lateral. Lead three, how do you see lead three? How does it look? Just más o menos, how does it look? Pretty normal,
No.
right? No? You have a P,
Well, no, sí,
you
porque-
are.
And it has the.
No, we're not going,
Okay, okay.
we're just kind of, quickly like looking at it, right? We're not going through the
Sí,
criteria yet.
Sí, está
So I can get you used to going looking at, so AVR, okay, AVR, remember, is the only one that has an inverted P wave because the direction of the electricity is going back. So you have an inverted P wave, then you have a little R and then a deep S, and then it goes back up. Just look a little funky. And then AVL, what's wrong with AVL? AVL, the one that view from the top left. Tell me what you see.
It has the, está abajo.
Up abajo?
Está abajo.
It's a deep S, right? I know it's hard to tell because it's very small, but it looks like I have a tiny, tiny R, and then it goes back down, right? Or the R looks almost like it's like an inverted R, right? Okay, so it looks fishy. What about AVF? The one that's looking from the lower part to the upper part of the body. What is wrong with that one? Anything wrong that you see? It looks pretty normal. So that's AVF is what part of the heart? The lower part. It's a view from looking at like the heart's here and you're over here, you're looking at the heart, this part, okay? The right side bottom, the left side, the bottom part, and the bottom part. Okay, that's AVF. Okay, moving on. V1, chest lead. Okay, very deep S wave, okay? Remember, the first upward deflection is gonna be your P, and then you have a little Q, if any, and then you have an R, and then you have an S, which is down. So if you look at V1, guys, the P wave looks kind of weird, okay? And then you have a very small R, because it's pointing up, very tiny, and then a deep S. And then it goes back up, right? And look at the next one and the next one. Okay, so something's going on with the S wave, right? And V2, very deep Q wave. There is no R, it's just downwards. It's a Q. Okay, so that is just a Q, and then there's no R. And then you have your T wave, and then a Q. I think there's a P. I don't know, look with that purple line, it's hard to tell, but it's a Q and then a T. So there's no R.
Es purple, no es azul.
Hmm?
No es azul.
It's way to middle purple. Right? I don't know, blue, purple, something like that. And then V3, same, but look at the T wave now. It's looking a little bit different.
It's white.
It's very wide and it's kind of like, I don't know. Okay,
White
so,
and sorry.
okay, now look at V4. V4, You see how it looks kind of like a little chair or a little tombstone? That ST elevation right there. That is an ongoing heart attack on lead V4. So what part of the heart is it looking at? All the chest leads should have upward deflections. They all should look nice and normal. P, Q, R, S, T. That's exactly how they should look like. This does not look like that, right? I know anybody can tell that knows anything about EKG, you know that something's wrong with that one, right? And so the other ones too. All the chest leads, except you notice they get worse and worse and worse. Right now in V4, you're looking at ST elevation. V5, you can clearly see the little tombstone there. And mira, V6 looks like a little chair. So definitely something's going on which part of the heart? What part of the heart did those leads look at? Remember, it looks at the heart through a horizontal plane. So if this is your heart, if you slice it like that, chest leads V1, V2, V3, 4, 5, 6, right? They're here. So they're looking at the heart through it, okay? Not like the other leads, this, no. The V chest leads are looking at your heart through the muscle, okay? So what kind of heart attack is this person having? So they focused on lead V1 at the very bottom. Looks, what kind of heart attack is this person having? Left, is it the left side of the heart, the right side of the heart, the lower part of the heart? Huh? It says anterolateral AMI. What's AMI? Acute myocardial infarction. Acute. Remember we said you have ST elevation, it's an acute, that means it's going on right now. Okay. So antero means what? Anterior, front, lateral. Right? So that's why you see V1, 2, 3, 4, 5, 6. So that's why you see the changes in V1. Exactly. It's anterior lateral. So this is my heart. And nothing's happening over here, anywhere here. It's more on this side of the heart. Because that's where the chest leads are, 4, 5, and 6 are, right? 6 is right here, 5, 4. So it's looking at my heart, a little higher here, right? My heart is actually right here. Okay, but the leads are detecting the changes, right, in the electricity of the heart in this part. That's what you're actually looking at. But in your mind, you're like, oh, he's having a heart attack on the left lateral because that's what the V1 through V6 look at. So what arteries are being affected? What arteries? Go back to this page, to the beginning. Page 336.
So part like the pulmonary.
It has to be an artery, but not a pulmonary because those feed the lungs.
Okay. The left coronary.
Could be the left coronary, or if you look a little bit further.
Circumflex.
Which one?
The circumflex.
The circumflex is the one that goes around, goes all around your heart. No.
There's the anterior interventricular.
Yeah, or we call it left anterior descending, right? And then because that one branches off to even more, right? You have the diagonal artery. So you have the left anterior descending and then have your diagonal. So either of those two could be obstructed, or the two of them are obstructed. So you see changes in the EKG. Remember, when your heart senses a decrease in blood flow, it's going to start to affect the electrical activity that's going on in the heart. Okay, so there's less blood flow there, then you're going to see the changes on the EKG. And this is an acute MI, the one we just saw.
¿A qué hora tiene su?
A las 11. Pero es
Me
aquí.
faltan 5.
Okay, so that's my page. Okay, 343. Okay, so that's what you're looking at. Okay, and the EKG that I saw the other day, it said that the person, it looked a lot like this one actually, a lot like this one. So I was thinking, oh, look, just like the one I saw the other day, yesterday. So the person did have a heart attack a long time ago. Okay, so there was a cue, but it was in another part of the heart. I think it was on lead 1. there was a deep Q, but that's a long time ago, right? So this, if there was ST elevation, that means that the person would be having a heart attack. But that's assuming that you are, you have the leads on correctly, okay? That everything is done correctly. Unfortunately, I have to stop, guys. I wish I would continue. I really like this chapter because it helps you understand, okay,
Okay.
what happens. So if you don't mind, you want to stay here, continue looking at that part of the chapter, heart failure. It's very common. Heart failure is very common. What is heart failure? When your heart fails to work efficiently as a pump, that you have heart failure. There's different degrees of heart failure. There's mild, moderate, and then severe, right? Mild, moderate, severe. Most people lie in the mild to moderate. When they have severe heart failure, you see all kinds of problems, okay? And they measure the heart failure depending on the ability of the heart to pump, right? The ventricles pump the blood out of the heart, okay? Remember stroke volume? You guys remember that? Stroke volume? We calculate cardiac output, heart rate times stroke volume equals cardiac output. Well, there's also something called an ejection fraction. Ejection fraction means how much blood is pushed out from the ventricles, okay? Both ventricles to the body and then to the lungs, okay? So they're measured in a percentage. We all should be working at over 60% of blood. Nobody has 100%, okay? So we all work at 60, 70% of blood pumped out with every contraction, okay? As your heart starts to fail because of a diseased heart, maybe you had heart attacks or part of your heart is already dead, or you have left ventricular hypertrophy, enlargement of your heart. Remember, we talked about earlier, it doesn't work effectively because it's so big that it can't pump effectively. That means you have decreased cardiac output or decreased ejection fraction. So anything below 30%, the person will definitely feel a decrease in activity tolerance. They can't do things that they can. When you see a person, if you have a family member that normally, like they say they're my age or they're older, and you know, they're pretty active adults, okay, for the most part, but then later, things they normally do, like cut the yard, do things around the house. If they can't tolerate that thing, that activity level anymore, that means that the heart can't keep up with them. That means that the heart has decreased, right? Cardiac output. That's what it comes down to. When males have problem with erections, like erectile dysfunction, it's a big sign that they have decreased cardiac output. That's one of the main signs that they see now in males, especially if they're younger, like younger than me. If they have that problem, because they shouldn't be having that problem, that means they have a weak heart, because it can happen in 20s, 30s. It can happen at any time. Okay, that would be a bad sign that the heart is not strong enough to maintain an erection. Okay, that's the whole problem. So that is another sign. Left ventricular failure and right ventricular failure differ a little bit. As you know, your left ventricle is responsible for most of the mechanical, right, function of the contraction. So the signs are more obvious, right? Left ventricular, if you remember the cardiac cycle, okay, the left ventricle pumps blood to the body, right? But think about it, the heart contracts, the blood goes out, right? Let's say I'm the blood, I'm moving, okay? And then it contracts and it pushes more. So the blood is always moving forward, right? Forward and then back through the veins, right? What happens if the heart cannot push it hard enough to?
Se queda estancada en ese cuerpo.
Well, yeah, later, right? But if it can't really move it, right? It's pushing a strong heart, the blood goes. But now you have resistance, right? Your arteries are like this. Your heart pushes and it can barely move. So what happens to the blood? It backflows, right? It shouldn't backflow in the arteries. So if your left ventricle pumps, gets its blood from where? From the lungs, right? Oxygenated blood comes from the lungs into the left ventricle, left atrium and the left ventricle. So then it goes out to the aorta. So it's backflowing into the what? Lungs. So what happens in your lungs? In the circulation of your lungs.
Get short breath.
It backflows into the lungs, and then you get a lot of blood flow in there, We call it pulmonary edema. So if there's too much moisture, too much blood in your lungs, your lungs can't pick up oxygen, right? It's too much, it's overloaded. So what happens to the person? Obviously they get shorter breath, right? Because they can't pick up oxygen, get rid of CO2, right? And then what also happens? They start to produce moisture inside the lungs, right? All that leak, remember that your arteries and your veins are permeable. That means that stuff
Por eso
goes in and
tiene la
out.
pulmonía y todo eso también.
So too much moisture, right? Backing up, all because the heart can't pump it around to get to the kidneys to get excreted, right? You see the swelling in the leg, usually the left leg, right? The left leg is called edema. In your lungs, you have pulmonary edema. It's a very serious condition. So how do we detect it? How do we stop it? We hear coughing, can hear the coughing. It sounds like they have congestion, right? But that's because they do have congestion. They start coughing up stuff like that, like a lot of phlegm.
Mhm.
That's because of heart failure. Most of the time, right? Huh?
Yeah, that's weird.
Why?
Pues like, something that you never thought, like, you see it happen, but you never thought it was related to your heart.
I mean, it could be a thing. So you have to look at the whole picture. What other conditions the person have? Is it just the heart failure, or do they have also a kidney failure, or do they have liver failure, or do they have other kinds of problems, right? They have bad venous flow and so on. There's a lot of problems. So you have to look at the whole picture, right? And look at the medications and see all those things and try to find out. Number one, right away, when somebody has heart failure, they're always going to be on water pills. You guys heard of water pills, diuretics, right? They're always, and they have to go pee and pee and pee and pee. We'll also have to monitor, manage how much fluid they take. Because if they don't, the problem just persists over and over and over. A very, very bad problem is, and people that are not compliant. So you're gonna see this problem all the time. Exacerbation of heart failure, because the person is not compliant. Well, it's hard not to drink water, right? Especially when they tell you not to drink water. You can't drink water, you get more thirsty, right?
Mhm.
Nobody tells you anything, you probably just don't drink water, because that's what we do. A lot of people don't drink water, right? Now they can't, they want to. So heart failure, guys. See you next time. We're supposed to finish today, right, Maria?
So, ¿cuándo nos
I know
vemos?
Friday we're doing the
Friday,
thing, right?
pero ¿cuándo nos vemos otra vez?
El viernes online.
Ajá, ok. Y luego de
Ahí.
aquí, ¿cuándo regresamos para acá? ¿Hasta November 2nd?
Sí. Sí. Yeah, so Clarice is like, what? Miss Annie, we're gonna finish it off because I gotta go. We'll be here online on Friday, right?
Sí.
Okay, online on Friday night.
Para PCT next. La última vez que venga, pues, la próxima vez.
Sí. So text Annie. 'Cause I don't know if she's
The
not.
Friday